arcade line.
Linea alba is the line between in the middle of the two rectus abdominis muscle, linea alba.
That should be
The semilunar line.
the rectus muscle.
This is the
뒤에 나온.
this is the rectus muscle.
나온다.
Oh, these are the rectus muscle, but like, yeah, underneath. This is the rectus. That's the rectus sheath. But in the middle, that's a linea alba, right? It's connection between them. Semilunar line is basically the line between separation between the actual belly of the abdominal muscles, and they have the aponeurosis, right? So that's the line between them. Right here. Semilunar line. Cool. Okay.
arcade line.
Arcuate line.
So this one is this endothelification. Yeah, endothelification.
Could be. Usually I pointed at the front though. Yeah, because that's where you see the difference between the rectus abdominal sheath, rectus sheath, and the. Rectus abdominis and right underneath the umbilicus. Where's the semilunar line? Arcuate line. So check. I'll check with him again. See how it shows arcuate line.
And the umbilicus.
Right here. Umbilicus and
Rectus abdominis
right
muscle.
here.
Abdominal external oblique muscle.
External is these muscles out here, right? External. This is the outermost layer.
Internal and transverse abdominis muscle.
The what? Abdominal, external, internal. Basically, the outer one is the external, the inner one is the internal. Actually, they separate them. It's just based on the fibers, right? That's rectus abdominis. Yeah, okay. It looks a lot better. Yep. Okay. Yeah, they split it. So you can just look at the fibers, right? External goes this way, internal goes the other way, and then transverse this way.
Transverse.
Quadratus lumborum
So
is at the
this is
wall
going
of
to be the minor
abdominal
highway.
cavity.
This one. That would be the minor highway, the first layer. The fibrous
You
layer.
have to. It's at the back.
Serous parts. Right?
Quadratus
Right here.
lumborum.
Quadratus lumborum. Have psoas major, and right next to it is quadratus lumborum. Psoas major and minor.
The fibrous parts. What is the one?
The what now? Psoas minor? Psoas minor is a little tricky to show because usually it goes together. Right? They go together. It has really small belly and long tendon. So, like for example, for this one, you see a little separation right here. There's a little tendon right here. Yeah, so they go together pretty much. At the psoas minor, psoas major, minor. But usually it's just point there. It's fine. Yeah, there's psoas major. Like this whole thing is psoas major and minor. They don't ask you to show psoas minor specifically. But if they have to, you just show it like a little superiorly. That's where they have a little belly and it fuse together.
Iliacus muscle.
The iliacus muscle is on the wing of the ala, like this one.
And the inguinal ligament.
Inguinal ligament is
Yeah, right.
this.
The superficial inguinal ring.
Right here, superficial. It's where the structure is coming out, the testis, right? The spermatic cord. Okay. This is a superficial inguinal ring.
And deep inguinal ring.
If you trace it backwards, you can put your thing in there, or you can look it back to back where the spermatic cord exits.
Okay.
Yeah. Oh, there, yeah, deep inguinal ring. Superficial is outside, and then they go through the inguinal canal, and then the deep inguinal ring is inside.
The transversal is facial.
Transversalis fascia. It's the fascia at the back of the transversalis abdominis muscle. So you find the transversalis abdominis muscle.
This way. Ah, okay, you can see it. This one, I think.
The fascia. Yeah. This is a transversalis fascia. Yeah. I mean, usually it fused with the parietal peritoneum as well. So if you point on the surface that on the side that covers with the this is transversalis fascia. If they ask for parietal peritoneum, just point
I would
here
say that this is
or
the
shiny
right
layers.
branch, or let's see. Oh, this one. Yeah, could be also. But here it comes.
Median umbilical
right on
fold
this.
in the
Yeah.
middle.
Okay, this one or this one.
Where the bladder is, you find the bladder. So at the middle, you look upwards.
He was like, this is the superior thyroid. This could be the laryngeal or this.
This thing cuts us ugly.
He was like, okay, it could be this. And then he said this one.
Median umbilical, somewhere right here.
The medial umbilical cord.
Medial is going to be on the two sides, but it's not so visible here. I think the other cadaver is better, with the little folds. This one has just had a lot of fat, so it covers the fold.
The lateral umbilical.
Lateral
Umbilical.
It's where the inferior epigastric vessels are.
What is this one?
What is this one?
Yeah, or is this right atrium? Left atrium. Wait, right atrium.
I don't even know how they cut it. It's a part of the parietal peritoneum. For sure.
Superior vena cava. See
I
here?
don't know why it's like this.
What is it?
Anyhow, this is the inferior epigastric vessel. Right here. Goes from here, internal. It goes from internal. Inferior epigastric vessel. Goes anteriorly, superiorly.
이제 왜 하는 거야? 나 lateral umbilical cord 물어봤는데.
Just say parts of the atrium, like parts of the atrium and ventral or something like that. For the why is this something with why is this blah blah?
짱이 좀 나네.
몰라 지금 라테럴 umbilical cord 물어봤는데 지금 이러고 있어.
Remulla themselves?
더 이상 안 나네. I don't know. It looks weird. I'm trying to figure it. Where does it come from?
What is that?
I have no idea. It's an artery.
Sinus vena roncada.
Doctor's deference.
Yeah, that part is.
Wait, doctor's deference. Yeah, doctor's deference. Makes sense. For the sperm. Yeah, because it comes from the inguinal ring, from the testis. It goes back to the bladder, seminal vesicle.
나 우리 이거 한번 찍고 하자. 중간에 물어볼게. Medial lateral inguinal fossa.
I think this should be
Okay, this thing is very bad at showing the folds.
Median and lateral inguinal fossa.
Neolateral inguinal fossa. I think it's better on the other cadaver. This is the medial one, this is the lateral one. But it's not very. Medial has the inferior epigastric vessels. Yep.
봤어?
Oh no, lateral. Medial is
뭐 했잖아.
Show it again, please. Medial lateral inguinal fossa.
medial and lateral. That is the medial one. The lateral one is just the outside. It's not very visible right here. Yeah, just approximately right here.
The parietal and visceral peritoneum.
Parietal and visceral peritoneum? Parietal? Visceral is on the only intraperitoneal organ. Don't point at the, I don't know, the horizontal part of the duodenum or something. Or ascending part of colon. That's not intraperitoneal.
The peritoneal cavity.
Peritoneal cavity is just this is the whole peritoneal cavity.
The greater omentum and lesser omentum.
Is gone. It's gone. But you can point out it's a little part of it right there. Yeah, just the remnant of it. Yep. Greater omentum.
Greater omentum.
Yep, it's covered.
Lesser omentum.
Stomach.
Lesser omentum 여기 아니야? What about the lesser omentum?
The lesser omentum is kind of it's a ligament. It's basically the ligaments between the liver and the stomach, which is not so visible. But the ligaments of the liver to the stomach, they're all cut. I don't know. This between here, right? You remember? It's the lesser omentum is formed by the hepatogastric and hepatoduodenal ligament. Yeah. Yep. So it's here, but they have to remove it to see all the vessels and to see the behind back of the
The
stomach.
omental bursa and epipluid foramen.
Yeah, omental bursa is where if we have the lesser omentum right here, there will be a little hole at the back of it. It's called the epiploid foramen or omental foramen. You go through that hole, then that's where you reach the back of this stomach. Right here, that's the omental bursa. Behind posterior part of the stomach. And usually there's a lesser omentum that covers all of this. Yeah, so you can't access it. There's only a little hole at the back right here. Right? Yeah. And then right here is the retroperitoneum part, right? So you can't even go there, right? It has a peritoneum. That's what's formed the lesser omentum, but it's all cut that I said. Hepatoduodenal connects the liver to the duodenum. Gastric ligament connects the gastric part with the liver. It's the ligaments.
The falsiform ligament. Gastrolineal ligament.
That's the falciform. That's falciform. Gastrolino ligament is between the stomach and the spleen. Okay? You can find it.
Is this spleen?
Yeah, that's spleen.
So, like,
Okay, anterior part. Bé nó connect với cái liver với cái anterior. Khác với round ligament.
is this a
Yeah, I think so. It looks like gastrolino. Gastrosplenic or gastrolino.
Gastrosplenic or gastroleal.
That's it.
Cái round ligament nó có hình tròn. Cái round ligament nó hình tròn. Fascicle mà nó thường fascicle nó phía trước.
Can I disturb you again? Where can I find the thyroid?
Gastrocolic.
where can you find this?
Transverse colon.
How do you know that the thyroid is important?
Gastrocolic.
This one or this one?
This one. 'Cause it
I mean,
has
or you can
supposed to
point
have
at
a bunch
where
of
the
branches. And
the greater omentum is, but at
Oh,
the
this
little
is thyroid.
posterior part of it, that's where the
Is
gastric
thyroid
and
equivalent to
colon
one?
connect each other.
It's an artery or the lymph one?
it's an artery.
It's an artery. And it is the second
The
branch of the
area of
subclavian
the-
artery? Paracervical trunk? Is the paracervical trunk second branch of the subclavian? Or is it
Their area of the
second part?
Bare area? Bare area.
Yeah. Okay.
Is this the right? This is the right coronary artery.
Yes.
This is the right coronary artery.
Right coronary. Yes.
34번.
There you go.
Okay. Now we're IDing the thyrocervical trunk.
It's big.
What is
This
the
whole thing. But basically,
It
it's
is
a little hard to see right here. But yeah. You see how the superior part right here doesn't have a shiny layer, right? This shiny layer is the peritoneum that covers it, right? But the liver itself has this thing that connects when it touches the diaphragm that the peritoneum doesn't cover. So it looks different. It is not as shiny, right? So that is
If you have questions with the heart, I know.
like this layer makes it shiny,
internal
right?
thoracic
This is just fat. Okay, did you see it clear?
Thoracic. This is left.
Yeah. Yep. So this is the peritoneum itself. That's why they usually call the peritoneum is shiny layers because it's glossy,
That is the
shiny.
third,
When you go to pathology,
branch of the-
that's what it's called. But the bare area is this
Yeah.
one when you actually see the liver capsule, the tissue of the liver. Yeah, and that's this bare area.
Right
I
and left
guess.
coronary
I
ligament.
have no idea.
Right, and left coronary ligament.
This is the internal thoracic artery, so they
Oh,
have
right.
placement. So your vertebral artery is
I'm so confused with this.
here, this one.
Why is it
So
so
let's say the
weirdly
internal
shaped?
thoracic artery is the right opposite.
Yeah,
Oh, hump.
yeah. This is vertebral. This is the thyrocervical trunk.
Right and left coronary ligament is just the.
This is the thyrocervical trunk, and this
Right and left
cut off
triangular
artery here
Yep. Triangular ligament.
is the
This
internal
is the right part,
thoracic.
right?
That's the left one. Left lobe, right lobe is bigger. Right one is somewhere around here. You can't see it. But that's basically the ending, right? You have the left one is at the ending right here. The right one is disappeared somewhere here.
This is right part.
Here, right? It's
Okay.
between the myohyoid.
Mesentery proper and roots of mesentery.
Mesentery proper.
So it's just here, like here.
Yeah.
Between myohyoid and
Yep. These all of the small intestine is a mesentery proper. Yep.
Root of mesentery.
So the mesentery is when you pull up everything.
So this is your hands.
I'm not in position to pull them up, but basically you just hold everything up, the whole small intestine. So like, oh wait, they have to cut it. Yeah, these are the roots basically. Basically, there's a root that goes out and holds all of these mesentery properties.
The mesoappendix.
This is the coronary side.
His appendix. Find the appendix. Can you find the appendix? Yeah, connects the back of the peritoneum with the. Yeah. Okay, got it. That's the mesoappendix. That's the appendix, and then you find a little fat. It's the appendix. You find a little fat behind it that connects it to the wall of the. Basically, the fat around it is the mesoappendix. Mesoappendix, mesocecum. There's also some fat at the back there. The cecum.
This is the
Yeah,
posterior
mesocecum.
and then the medial septum. Which is the mesocecum?
Mesocecum. Mesocecum is usually at the back as well, but some layer right here.
This is septum.
It connects the cecum to the posterior peritoneum.
The transverse mesoculum.
Transverse
And this is the,
mesocecum.
I love this thing. What grade Like this mesentery.
Just find the transversal one. Yeah, just point at the. Yeah. Yep. Transverse mesoculum. This is where these fats at the inferior border.
In the diaphragm, central tendon.
The valves are
And then it's the middle part of the
Okay,
diaphragm.
no, it's there.
어디 어디야?
You guys see inside here?
Right here. Central tendon.
And it's
Yeah, that's the central part of the diaphragm.
I just the whole region is
It's
called
the region, yeah, because you have diaphragm has a muscle around it, and in the middle the tendon is inside the middle.
spots.
The central tendon part
And
is
this
central.
is like the
Yep, and then you have muscular part.
Where is the muscular part?
These are the muscles, yeah. You see, this is a muscle. This is
side
the
part of the
tendon.
muscular part, the center part is the central tendon.
Yeah, where it's white is the central part, where it's black is the muscles.
And the costal and lumbar parts.
Yeah. Diaphragm has three connection with the muscle attachment, insertion, origin. Three origins. At first, it has the sternal part, which connects to the sternum, like anteriorly. Okay, it has a sternum right here. Okay, secondly, you have the costal part, which is these, right? It connects to the ribs around it. And then lastly, you have the last part is the lumbar part, which connects to the lumbar, right? So like the muscle that at the right this next to the lumbar. Does it make sense? Okay, that's the lumbar part of the
aortic hiatus.
aortic hiatus. Aortic hiatus. Aortic hiatus is
Yeah, you see what this one is.
What is this? Oh my goodness.
right here.
The first one is everywhere.
Bless you. I think it's this one right here. It's the opening of the aorta.
Esophageal hiatus.
It's where the esophagus is entering.
Just the same as.
Esophageal hiatus.
Esophageal hiatus.
Yeah, that's where the esophagus goes out and connects to the stomach. Aortic hiatus is where the thoracic aorta goes down to form the abdominal aorta, and the cable opening is the opening of the inferior vena cava. Right? Cable.
Vena cava foramen.
Yeah, oh, this one, vena cava foramen. This is the inferior vena cava. The opening right there is the inferior vena cava. Vena cava foramen. Cable opening.
Esophagus.
Esophagus. Esophagus. Esophagus. Esophagus.
This one?
Yeah. Connects to the stomach. This is cardia. The neck.
And the stomach or cardia fundus body.
Okay. Cardia. Yeah, cardia is right here where it connects to each other. Okay. Where the esophagus connects to the stomach. Cardia fundus is the top part. So like at cardia, you have this little notch right here. It's called a cardio notch. Okay. Cardio notch. And if you put a line horizontally above it is a fundus. Okay, above it's a fundus. This is the body part. And until right here, you find this is the pelvic antrum, right? This is a lesser curvature, this is a greater curvature. The lesser curvature has this, when it goes diagonally and it goes horizontally right here, that's right here is called the angular notch. Right, and you form a line right there that splits between the body upwards and the antrum. So cardio notch up here is splits the fundus and the body, angular notch splits the body and the antrum.
The anterior and posterior surface of the stomach.
56, pylorus.
I think it's a deep
Oh, I know this one. It's like here. Crazy. Which one is this one? It's like here.
어쩔 수 없어. sorry.
어떤 것까지 없어졌어?
That one is
The pylorus and pyloric antrum.
Oh, okay, so
Pyloric
this is
content.
The pylorus. This is the pyloric antrum. Okay. As I said earlier, separation between the angular notch. Antrum. It takes you into the pyloric canal, and then it takes you to the pelvic sphincter. Sphincter is the big part right here. It's a bulk.
Antrum, canal, sphincter.
Antrum, canal, sphincter.
Wait, this is the subclavian, right?
And there's the duodenum.
So then
And the
this.
next part, right after the sphincter, is the sphincter helps you to, limit the food from the stomach to the.
Superior horizontal part of the duodenum.
That's the first part of the horizontal.
Yeah, so like,
And descending part of the
maybe it
duodenum.
was
The
here.
second part of the duodenum, it goes downwards. So basically, if you follow it, it has the first part that goes horizontally, second part goes downwards, so descending, third part goes a little horizontal again,
But I think I
and
can
then
show
fourth
you
part
here.
just go
Standing
Yeah.
right here.
66번까지 한다. And duodenal jejunal flexures.
Yeah, that's at the ending of the duodenum where it goes out and it becoming the jejunum, right? So like duodenal jejunal flexure right here. You should just
So this is the end of
Show
duodenum.
here. Is it this?
yes, this is the end of duodenum.
Internal thoracic artery is down.
Wait a minute.
Vertical internal thoracic.
Wait a minute. Let's just.
Thank you. Common carotid artery.
Yeah, that's the duodenum.
So yeah, this
Yeah, that's the duodenal jejunal flexure. How do you differentiate between duodenum and jejunum? That's impossible. Yeah. Macroscopically, that's impossible. They look exactly the same. Histologically, maybe, but still, they both have like microvilli.
일레움 jejunal 꼭 못하는데? 리스트 이거.
I mean, in histo, you learn probably they have like bigger patches in the ileum, and in jejunum, you have what?
No, lingual.
이게 제주놈이고.
Microvilli.
수영과 제주놈은 구분을 못한다.
What is this then?
The alveoli, big thing. Yeah. But still, like in surgery, the same thing.
So wait,
They
this
look
is
exactly the same.
thyroid. This is
일레오시카 junction.
superior thyroid goes to the
Yep, right there.
thyroid.
Same.
And then from the
The
superior
secum-
thyroid we have superior laryngeal, okay, which is this.
Ascending colon, transverse colon, descending colon, sigmoidal colon,
Maybe this one is actually
sigmoidal colon.
Visceral surface of liver.
Visceral surface of liver right here. Visceral is just the visceral organs itself.
The diaphragmatic surface of liver is
Okay. Diaphragmatic part of the liver. Okay. Sorry. So actually, this top part is the diaphragmatic part of the liver because the anterior part of the liver is covered by a diaphragm. Posterior part is the visceral surface. That face, it has the kidney, it has the ascending colon, yeah, and the stomach itself. So.
the inferior margin of liver.
Inferior margin of liver. Inferior margin. That's gonna be this inferior margin.
Inferior, this part.
Yep. Inferior is this part.
Okay.
The liver locates just like this, right, in the body. So,
Ah.
yep. So anteriorly, inferior margin, visceral margin, surface. The diaphragm covers it. Okay.
The quadrate lobe of liver.
Quadrate lobe. Is it the top one or the bottom one? The bottom one? Yeah. So the quadrate lobe's right here. The caudate lobe is right there.
Caudate lobe.
Quadrate lobe. Left lobe.
Quadrate, right?
Quadrate. Yeah. This one looks more quadrate, right? Yeah. I think so.
Round ligament of liver.
This round thing at the back. Okay. Round ligament. Usually falciform ligament is at the anteriorly. It's like this extension of the peritoneum. Because you know, embryonically, the falciform ligament is the connection between the liver and the anterior abdomen. Right? So it's a remnant of it, falciform ligament. And round ligament is at the back. This is the remnant of the umbilical vein, I think.
The porta hepatis.
Porta hepatis. It's a portal vein, right?
But they run together. Yeah. Okay. And this was lingual. So this whole
The
thing.
Oh wait, porta hepatis is the high level of liver, this whole thing. Porta hepatis is this whole thing. Okay. Portal vein is this one thing. Okay.
The gallbladder.
The gallbladder
Superficial temporal
is still in there. I think it's gone.
facial vein.
I mean, it should be connected with the liver. If it's not with the liver, it means it's gone. Right, it should be somewhere here. Here, gallbladder. It used to be. Gallbladder.
The common hepatic duct.
Guys, we will be recording. We would really appreciate it.
Common hepatic duct. Remember that for the bile duct, you have the common hepatic that goes from the liver, connects with the cystic duct from the gallbladder, and they form the common bile duct. So common hepatic from the liver, cystic duct from the gallbladder form the common bile duct.
Did you guys finish this basic foundation of your
Cystic, common hepatic, or common bile duct. Bile duct exits through the descending part of abdomen. The common bile duct joins with the pancreatic duct. They form an ampulla, and they secrete bile into the duodenum through the sphincter. The greater papilla
Can someone hold
splatters
this?
the greater duodenal papilla. It has the Ali sphincter. Yep. Yep. Right there. Yeah. Okay. That goes to the descending part of the.
خلص تركوا
Yeah, تركوها خلص. Like this is fine.
connective tissue درسناها
Yeah. Okay.
what's
So what are the structures?
See it.
Common carotid, yeah.
Right.
okay look
Start just
Common.
say,
all right so this is the parapharyngeal
Pancreas.
lateral
Pancreas.
pharynx. This one is the superior cervical ganglion.
Oh, it's
If
removed?
you're asked to point at the sympathetic trunk, the neck region,
Yeah, remove the top.
continuous with the sympathetic
Oh,
trunk.
it's removed.
All right.
한글에서 없어?
This seems to be the
yeah, I got you.
this is the common carotid artery.
Yeah.
And then this is the internal jugular vein.
No.
One sec.
We have a little bit tissue of it, but I think it's removed.
Moving anteriorly, that's the
Maybe just a little bit of it. It's
Accessory is any nerve piercing the sternocleidomastoid. So it's just pointing here. This is a nerve piercing the sternocleidomastoid. And then the next part is done with that. And then this is the vagus nerve. So we're done with
diaphragmatic surface of the spleen.
11, 10. And then
It's
for
the
the
anterior, it's the posterior
glossopharyngeal
surface of the
nerves,
spleen.
Posterior.
스프링 어디 있는
That's the spleen right there. I think we can point it at the.
glossopharyngeal nerve, anyone?
Posterior surface of the spine is the diaphragm.
Let's go to the organ itself. And
Wait, what are you looking for?
Glossopharyngeal.
Glossopharyngeal?
I remember we once played type glossopharyngeal.
야, 너가 저기 있을래? 네, 찍어볼게. 저 이따가 저 베스를 해야 될 거 아니야? 아니 저기 우리 베스를 해야 돼 베스. 송어 정도도 여기 있어. Sorry.
it's occupied for spleen.
이게 스플린이야?
Yeah, this is spleen. Okay, that's the spleen, right? And you just remember the spleen, when it's located in the body, this smooth surface right here is a posterior surface. And the hilum face anterior.
This is like the anatomical.
Yeah, anatomical position of the spleen. It's like a little tilted to the superior pole, inferior pole, tilted a little, okay? And the face a little like this. Okay, because this is where the stomach gonna be on. The kidney, okay, a little colon, the left colon flexure, okay, where the transverse colon goes and the descending colon. So yeah, so this surface is covered by diaphragm. That's why it curves like a diaphragm. So this is a diaphragmatic surface. Okay. What else we have? Visceral surface. Visceral surface is right here, right? Where it's just face all the organs.
The superior and inferior border of the spleen.
The superior border or superior angle, I mean superior pole of this is right here, inferior pole of this is right here, right? Yeah. The superior, so basically because it's lying like this, okay? So this is like superior border, right? Inferior border is here. Just remember.
The helium of the spleen.
Pectoral spider.
키드니 있어, 키드니.
Isn't there like a middle one?
Next is kidney.
Kidney?
So what's this? Oh, intercostal.
Yeah, that should be right.
아니 고생한다. 하나 찾아내서.
Internal intercostal. It's inside.
복사시켰어.
So inferior.
뭐 있어?
Posterior.
파이널티에서 하나 사고. 너무 미안하다.
No, this is anterior. Posterior is a posterior.
Which one's not cut?
Shiny.
This this kidney is not counted. It can put the inside part.
Helium of the kidney.
Yeah, well, hilum of the kidney is right here. Hilum of the kidney.
Renal pelvis. Also.
Renal pelvis.
Yeah, it's inside. Wait, let's see if there's a kidney that.
이 사람 뭐 안 들어가고 너무 힘들어.
아이고. 이게 안 쓰세요.
Yeah, that's good.
이게 끝나고.
The renal pelvis is right here. Okay. That's when before I turn into ureters. Renal pelvis.
Renal sinus, renal cortex.
Renal sinus is all these where all these fats located. Okay, renal sinus. The fats in between. Okay, the medulla. Renal cortex is the outer part. Right, besides the pyramids, right? You have these pyramids, the outside part of the pyramids. That's all the renal cortex. And then you have the renal medulla, is where it contains all the pyramids, right? And the pyramids are these individual ones.
Renal papilla.
Renal papilla is the tips of the pyramid.
Tips of
The apex of the pyramid. Yeah. Papilla.
major calyx.
Major calyx. Okay, but the papilla drains into the minor calyx first. Okay, these you have small minor calyxes. Minor calyxes. And then it comes into major calyxes, is the bigger one. You have like 3 or 4. And then these major calyxes drain into the renal pelvis. And renal pelvis drains into the ureter, and ureter drains into the bladder to urethra, and then you excrete. Renal columns is between the pyramids, right? The space between the pyramids. It's a renal columns.
Adrenal gland.
Renal gland is not here. It's on top of the. It's on the superior pole of the. It's supposed to be here, but it's not here. Maybe this is a little part of it. This is a little part of the renal gland.
아, 미안해 죽겠네.
이런 먹어도 이건 좀 아니고.
아니 체력이 점점 감소하는 게 눈에 보여.
눈이 천천히.
네가 부를래? 야, 네가 말 좀 해봐. 끝나고 음료수 사겠다고.
나도 쉬고 싶지 않아.
어차피 집 가잖아. 니랑 나랑 가. 남자가 편하지 않을까? 내가 살 테니까 너 따라가게 하자. 하나 해줘야지. 왜 일이야, 이 새끼. 돈도 안 받고 하는데.
Abdominal area.
The bulk of the penis is just sorry, just a second. The bulk of the penis is this root part. That's the bulk. Dura is the side. But that's only at the very base.
이거 끝나면 헤드엔딩 할 시간
Because then
없겠네.
the dura turns to corpus cavernosum and the bulk turns to corpus vaginosus.
시간이
It's only point at the root.
1시 15분에 끝나지.
Oh, that's just spongiosum. Okay.
이거는 다 아니까 듣기만 하면 되지.
That's good. It's not like the first time I've seen this.
저 abdominal area check please.
Many thanks.
미안해. 싫어.
That is the aortic.
This is the keratin. Sorry. Do you know where the
Cobra cavernosa. Cobra
이거 아니야? 스파인 쪽에 트라이앵글 Are we talking about the space?
She knows I said D. This is like
It's the first.
앱도를 열때 뭐라고? 이거?
what's the
celiac trunk.
Just a second. I'll give it the carotid triangle.
Triangle was taste.
Okay, triangle. Borders of the carotid triangle.
One second.
The cervical one. Okay, second one is the superior belly of omohyoid, which is this one, right? Okay. Wait, no, maybe not. Maybe not.
Splenic artery.
Thyroid.
야 내가 찍을 때 내가 부를 때니까 네가 찍어라. 못 찍겠다. 일로 와.
This is a
깜짝. 너 일로 와.
this is like a
Well, I know this is everything is there. Tunica albuginea is one that covers it.
이거 여기
Tunica albuginea.
And the last one is the posterior belly of digastric.
Splenic artery.
So I think yeah. So this is
Celiac truncus oblique one.
You have the little triangle that contains. Yep, the carotid.
So it's supposed to be posterior belly, omohyoid, and
Superior belly of the superior belly of the
superior belly of
Yep.
omohyoid.
To be specific.
Okay, now we need submandibular triangle. No, you did the potentially.
splenic artery.
Splenic artery.
Splenic artery.
Yeah.
What was it? Wasn't this?
The curvy ones, first branch, well, second branch of the celiac.
How's the curve?
This one?
Yep. It goes to the spleen. So,
The left and right gastromental artery.
left and right gastromental.
By the way, you can stand in here because I asked them. And you know the head.
홍리절로 가지면 안 돼?
Right gastromental. It goes along with the
Okay,
curvature.
so
Right
here
one.
we have the vagus and frontal. For some reason,
Right, left.
but it's just
Right, left?
Yep.
Yeah. Right gastromental, left gastromental.
Wait, try a question. Usually how we identify anterior scaling is that the phrenic is on. Okay, that was our tip for the last one. But here we can't see no phrenic on anterior scaling. This is anterior scaling, right?
Yeah, I think so. I think
And then on this side, where would it be? This thing?
yeah. Oh, you see a little tendon right there.
Oh, okay, this does make sense. This is
Okay.
biggest.
Right gastromental.
I was right. Can you believe that?
Left gastromental.
아 진짜?
Okay, yeah. Also, you know that's a brachial plexus exits from the
Left gastromental.
scalemal triangle. So basically, the scalene triangle forms by the anterior scalene.
left gastric.
Okay, so these are brachial plexus. They come out of anterior scaling. And anyways, you can see
야,
vagus on
랩트 가스트로 어디였죠?
Between the anterior and middle, that's where the scalene triangle is, and that's where brachial plexus exits.
Okay, where's the anterior? Anterior and middle. Between the anterior and middle. So
Oh,
where's
okay. So
the
this is the anterior scalene muscle.
Okay, yeah, where's the middle?
The middle is just after that.
Oh, okay. And then, so can we see the posterior or no? Anterior, middle, and posterior.
I mean, it's you could if you, I don't know.
Okay, did you
Yeah,
get
that's a
about
fight.
between anterior and posterior, sorry, in between anterior and middle scaling, you have the scaling triangle.
Left gastric
Show me the
artery.
scaling
Left gastric artery.
Between
Left gastric
anterior
artery
and
is gonna be this one right here. Left
So
gastric
the scaling
artery.
triangle is
This
going to
along
be
the left
between
curvature.
anterior
I don't even need a scaling triangle. Let's focus on submandibular.
common hepatic artery.
Submandibular isn't supposed to be just somewhere here, bro. I don't know what the borders are exactly, but submandibular.
Do I need to learn this?
Gastroduodenal.
I'm gonna ask him.
Juan, so what is your first name Juan?
Yes.
Oh, your first name's Juan. Am I saying it right?
Yes. No, no, last name is Juan.
Oh, so your first name is? Sohi. Bro, I need your help. Submandibular triangle, right? Somewhere here.
Yeah.
Give me the borders.
Yeah. I don't know the border.
We're gonna ask him.
superior mesenteric artery.
Clavicular artery.
Underneath the celiac trunk. So
Where I need your help.
here, right here. Superior. Okay, I'll be right back. Superior mesenteric artery.
What's this called doing here?
Good here. Superior mesenteric artery. Right here. This whole thing. It gives you a bunch of branches right here.
Just whole thing.
Yeah.
Superior mesenteric artery.
It's right underneath the celiac trunk.
Underneath the seal.
이거라고?
Seal.
어려운데? 말지도 않지?
marginal.
Marginal goes around the border of the colon. So you find transverse and ascending, the vessels goes around.
Marginal artery. Or the colon.
What about the
Jejunal artery.
Find jejunum.
Yeah.
Jejunal artery. All things right there. Jejunal artery. So this right here. Okay, these arteries here are like twisted and everything.
Iliac arteries. Iliac artery.
Just find the cecum. Because the cecum helps you find the iliac part. And from the iliac part, you find some arteries, hopefully. Not really. Iliac arteries.
This part.
This very contains the iliac one, right? So it probably gives you some iliac artery anastomosis. There we go. Okay, you can check out a couple ones.
iliac polyculture.
And then I'll check.
Inferior mesenteric artery. 어딨어 iliac. 아니 방금 여기서.
Inferior mesenteric system.
Do you want to just do the oral cavity while we're at it?
Or inferior mesenteric artery.
Yes, iliac poly.
Okay, so submandibular triangle, right? Somewhere here.
Iliac
Yes,
artery.
okay, somewhere there. Yep, right there. Because you see the submandibular.
Where you see something.
Where you see?
iliac artery가 여기다 있는데.
Where's the border?
iliac 홀리움.
The border is the angle of the mandible. So your belly of digastric. And I think is the anterior digastric.
And then supraclavicular triangle.
Supraclavicular triangle.
This?
Yeah.
Okay, so what are the borders? The clavicle and then the
SCM.
SCM. And
아
then
이게 inferior mesenteric.
The posterior is the
I think we just need to know this like memorized.
trapezius, I think.
so it's just like clavicle SCM.
Okay, homoclavicular triangle. Okay, so it says it's like homoclavicular and homotrapezoid, right? They're
Yes.
like here. Where though?
Because you have the, so you have basically you have this triangle, right? The clavicle, the SCM, and you have the trapezius at the back. Okay. But then you have the posterior belly of the inferior belly of the omohyoid that's going to go like this. Okay. So it splits the supraclavicular triangle, the big one, into two smaller ones.
inferior mesenteric
The one
기억나요?
at the back closer to the trapezius, that's why it's called the omotrapezoid. Okay, because you have the omohyoid, the belly here, trapezius. So omo, trapezoid,
inferior
mesenteric.
then you have the omo.
이게 left 콜리니까.
Clavicular, which is the omo.
126번부터 안 했어.
And this whole triangle was called supraclavicular,
Yes,
right?
because it's all above the supraclavicular.
Supraclavicular was the whole thing.
Yes.
And then divided into two.
By the omohyoid.
But we don't have the inferior belly of
Yeah, this thing is
left
messed
colon
up,
wall.
so I don't know.
So this is this part is this part's gonna be the median cervical region.
The medial mediana. Yes, right at the middle part, right? You go from the hyoid bone all the way down parallel with these two like sternal hyoid muscle. And you go all the way down to the sternum. Yeah, that's basically the middle part. The cervical.
The lateral lingual nerve is where we're gonna find the lingual nerve.
Yes, lingual nerve and hypoglossal nerve as well.
Okay, so let's find it myself.
Is this just the omo? Yeah. No, it looks like a sternocleidomastoid. Sternocleidomastoid.
I think it's the hypoglossal.
Sternum hyoid.
It's like a hypoglossal to me. Have
you identified this is
I don't think you can see it here.
omo? Look at how it goes. Omohyoid.
Oh, you can see it here.
얼마 안 나왔는데.
Omohyoid is not so visible.
126번.
Also, come here.
But if you just look at the way the fiber goes, it makes
Try to find stuff there.
Do you have any tail?
찾아왔던 게
You
있어.
know, you know
This
naturally
is gonna
you
be
can
facial
tail.
artery.
네, 이거
And this is gonna be
그래서 우리가 막 하나도 모른다고
It's all
flow of
cut
the
to-
artery 달달라 해가지고 달라.
You can't really see it.
try. Can you come here for just 1 second?
땡겼어 사실.
Try. Could you please tell me the structures here? So this is facial artery, right?
You are correct.
Then this is hypoglossal. Is it this one? I think so.
Yes, sir.
비슷하지가 않대.
한 번에 딱딱하죠.
Is that
Something
one
up
here alveolar?
그거 많이 찾아야겠다.
하고 치워?
그래서 편집 그런 거.
나 편집 있다.
야, 리메디얼 10%라고 7이요? 그치?
Is the vessels over there better? Let me check.
Well, because the structures are damaged, so SCM should be like this. The clavicle. One head is the other head, so this is.
You see, this is the posterior parietal peritoneum. It covers the retroperitoneum, the arteries, and everything. So that's why we don't see the arteries or anything here, because she has not cut the parietal peritoneum. But we can see that there's a root of mesentery, which is
up to the jugular junction.
which is basically, this is the mesosigmoid, you see? Mesosigmoidal. So it connects the sigmoidal colon to the posterior peritoneum. That's what meso means, right? Meso means connection of the organ to the posterior peritoneum. Okay? So the root of mesentery is this whole root thing. Yeah, you see? It connects the whole jejunal, the small intestine, with the posterior wall. Yep, that's the root. Parts of the root. And then you have mesentery proper is between them. You have mesosigmoidal, you have mesocecum, and mesoappendix.
Isn't it supposed to be connected to the?
Yeah, it should be. Yep, I think it's a little separate.
Well, I think it's inside. I'm not sure.
moving on.
She said like this.
Cannot see arteries.
Yeah, we cannot see arteries. Have to go back over here.
땀 교수가 여기까지 와서 어디야?
네, 오늘 내가 왔어.
This is ureter. So abdominal part, if you follow down to the pelvis, then this is pelvic part.
Which one was it? This one is urethra.
This one.
Okay. Maybe I'll find something here.
Oh yeah, this one is urethra.
Okay, this is the
This one.
iliocolic artery. That's the right colic artery.
Right colic artery.
Yeah, I suppose.
Colic, ileocolic.
Right colic, iliocolic. Okay. Iliocolic gives you a couple branches, but it's not visible at all right here. I mean, this could be cecal branch. It gives you branch to the cecum. So you have the cecal artery, you have the appendical artery, and then you have also branches to the terminal ilio. Okay. The ilio artery, that's a tricky one because
Sticks of the vesicle.
they stuck to the. I mean, these could be the part of the jejunal. That's the veins. And this could be the ilio artery right here, right? Ilio artery. Because I'm just looking.
Ligament covering is the same.
Jejunal artery.
이거 네가 좀 불러보면 안 돼? 나머지 네가 불러.
지금 left colic.
Ilio. Okay. Ilio, jejunal. Okay. Iliocolic. Right colic. Okay.
Ileal
Yeah,
artery.
this is twisted.
Jejunal artery.
It goes in order, right? The jejunal has the most branches. And that's the jejunal. Yeah, it's the most leftist one. The one that goes a little downwards to this part. That's where the ilium is. That's the ilio artery. Okay. The one goes to this cecum. This is iliocecal artery, and the one that goes to the right is a colic. Right colic.
Right colic.
Right colic. And then you also have the middle colic. Middle colic goes upwards. Probably this one right here. So this middle colic one.
Where's the left colic then?
Left colic is from the inferior. So everything is from the superior mesenteric artery, right? These are the branches superior. Then we go to the inferior mesenteric artery, right? Inferior mesenteric artery, then it has you the left colic artery and the sigmoidal artery, right? The left colic artery gives you the ascending branch and the descending branch, okay? The ascending branch anastomosis with the right branch of the left colic middle colic artery. So the middle colic from the superior mesenteric goes upwards and it has the curves around the transverse colon.
Excellent.
Yep. This one gives you the left colic. The left colic gives you a branch that anastomosis together. This whole thing is called the greater arc of Brioland. The greater arc of Brioland. Okay. You have the sigmoidal artery right here. Goes to the sigmoidal colon, and then you have the last branch is the superior rectal.
Superior rectal artery.
I don't know. I don't see it. But there's should be the third branch, superior rectal, that goes to the superior rectum. Because you know, superior 1/3 of rectum is intraperitoneal.
Like it comes out from this branch, or like is
It should come out from the inferior mesenteric artery.
What's the next one?
But it's yeah.
크게 말해서 이렇게.
Vasa recta. Vasa recta is on these jejunal and ilio. So you see all these vessels. They have so first the jejunal is the big one outside, and then they form little like curves. These curves artery. This is called the arcuate arteries. Then at the very external part, they form straight artery outwards to wrap around these. These are like vasa recta.
Vasa recta.
It's a very distal part of the
Vasa recta.
the jejunal artery, for example, because ilium also has it. And then it forms arcuate artery. They have these curves around, and then this has vasa recta. Maybe I could draw you
Where
guys.
is the inferior epigastric artery? Epigastric.
Inferior epigastric is on the
It's hard to see.
It's not that hard though, because
It'd be like
lateral,
identify it around
lateral
there. It's
umbilical
just that
fold.
maybe?
Yes.
You have to find yes.
it's just that the head is positioned weirdly here.
I think so.
inferior epigastric artery.
And renal artery. Renal artery.
Okay, it came back to
On
original
the
place.
abdominal.
Okay.
Here, find a kidney.
So
Kidney, right?
this
Find the abdominal aorta.
retromandibular.
This renal artery is the artery of the kidney. Yeah, renal artery.
And testicular artery.
Yeah, it's all hard.
Underneath the renal, you find the two small branch that goes upwards. Not that one.
Yeah, because like the vessels gets inside this one.
Yeah, it's on that side. They said that this was like it was on that side.
Yeah, it's so the brachial side.
Wait, if you ask me the Vegas, it's right. You said this is the Vegas.
Testicular artery.
This one is artery.
Yeah, in vein.
Guys, can I bother you for a minute? Just a tiny little minute.
Testicular artery.
Okay.
I just want to ID two structures. Just two structures. Sorry, thank you so much.
이렇게 할 수는 없어.
Can you help find the ovarian artery? 여기서 오죠.
Brachial separate brachial artery.
Well,
Yeah.
아니 물어보는
Where is
거
it?
이거 아니야?
On the right or on the left? It's on the right side. It's only on the right side.
So is it this then? Yeah? That's regular vein.
The arch of aorta. Arch of aorta. And then
이건 아orta.
it's this one.
이게 커먼.
Brachial separate. Brachial separation. Yeah, so this is a brachial separation and that's a subclavian.
이게 abdominal artery. 137번 common iliac artery. 그다음에
Azygos on the right. Same
Ventral.
place as the azygos.
external iliac artery. External. Internal iliac artery. Internal.
다 찍었어. 찍은 거야. 그것도 찍었어.
For the average if you're gonna cover it here. Here. What's if you're gonna cover? And this is a superior vena cava. So this one joins the superior vena cava. And this is and then this side is heavier. It's on the left. On the right is esophagus. The left is and then the heavy esophagus drains into the esophagus, and then the esophagus drains into the superior it comes up, cross,
Oh, this is a male, yeah, for sure.
After we can show us the
Yes.
first the hepatic portal vein.
so you have to find this one.
Like flat thing.
You point
right
on the liver.
above something, right?
Above
Here,
the
here.
esophagus.
Hepatic portal vein.
Hepatic portal vein.
Maybe you can say it.
I remember it was like a flat structure.
At the hilum of the spleen.
하일로만 있을 때 아까 티슈줄에
Yes, exactly. That's the hilum. That's the spleen vein, right? It connects with the spleen, and it goes to the. It turns into a hepatic portal vein right here. Right? Remember, hepatic portal vein is formed by the splenic vein and the superior mesenteric vein, right?
Yes. Could you show us the thoracic duct?
Hepatic portal vein right here, splenic vein right here. Yeah.
The thoracic duct.
Thoracic duct.
I can't find in this.
I can't find it earlier either. It was very misleading. I think we should ask him. Ask him to show.
Is this the superior mesenteric vein?
That is the superior mesenteric vein.
Superior mesenteric vein.
I remember it was.
Inferior mesenteric vein.
No, it was like a really flat
it's gone.
one. I remember.
Yeah.
She was like,
Or maybe it's right here. This one right here. Usually, inferior mesenteric vein should come from the splenic. I mean, the normal anatomical. But maybe there's some
I
variations here
think
too.
it's supposed to be.
Superior mesenteric, inferior
Maybe
mesenteric.
Yeah.
Does it look like
And
a
the-
hair?
It is a branch.
Yeah, I think that's the inferior mesenteric vein.
Splenic vein must come from inferior mesenteric vein normally.
다를 수도 있고. Renal vein. Renal vein.
Okay. Renal veins?
Yeah, renal vein.
Looking for the thoracic duct.
Yeah, I'm not sure.
Right here.
What is it?
Renal vein.
Yeah, kidney. Renal.
Yeah, that's right. This
This
thing.
one?
Yes.
Yeah.
External chain.
Thứ năm.
Right there.
6 chứ?
Right there.
Yeah.
Right there. So you have to follow the vagus. This is the vagus. And the branch around
Is
here.
next to the celiac trunk.
Okay, right.
But the left is different, so you have to.
Where's the left one?
So I was hoping this is the vagus. So the left one is maybe must be this.
The left is curved around the
Yeah, so
outer.
that's this
This one.
So this is a Vegas. It's just got cut. Okay, that's all.
Thoracic part of
Can we just exactly where the location is?
Yeah, it's just right around the celiac trunk. Yes.
Celiac trunk around the ischemic.
Yeah. Right next to it, somewhere around here. Yeah. You see a little bulb, and this should be green. This is nothing green. It's the same thing.
Like around
Yeah.
here.
Around, but like the celiac cali is a bigger structure than next to it. Yeah. The celiac lymph node is like around the celiac trunk. Yeah. Makes sense. Around the. That's it's similar. You won't be able to point the lymph node itself because they will usually cut it off. So just point at where the artery is. So superior mesenteric arteries is where the superior mesenteric is, and inferior as well, right?
So the sympathetic column has a
lumbar lymph nodes?
paravertebral ganglion. So
And
this
next to
one
the
is a
lumbar
sympathetic
arteries,
column.
right? Because you find it next to.
And the
So lumbar arteries
paravertebral-
goes from the abdominal aorta,
paravertebral
right? So you just find it. Basically, you point at the.
Oh wait.
Yeah, it's should be around in that area. Lumbar lymph.
So this is a trunk, sympathetic trunk, thoracic, sympathetic trunk, and
Starting with the nerves.
the ganglion is just like, you know, the bulging.
For the nerves,
That's a paravertebral.
okay, first of all, you lift everything up. You use the psoas major. That's the first part, okay? And then from that, you can find a lot of things. For example, you have the femoral nerve, obturator nerve, femoral nerve. Okay. Femoral nerve is located on the external side.
신경의 끝이야? 저거에 붙어 있나? 신경하고 끝이야.
Okay, right here. So femoral nerve is out here, right? Okay, you go find how to go. So based on the psoas major, lateral to the psoas major, you find the femoral nerve, right away. Very easy. Okay. On top of the psoas major, you find the genitofemoral. Okay.
Genital femoral.
Yeah. It runs on top of the wait. It runs on top this one. Genitofemoral. Okay. It runs on top of the psoas major. Psoas major.
This is the femoral.
Femoral nerve.
And this
Genitofemoral.
femoral.
Genitofemoral.
genitofemoral.
Yep.
And sympathetic trunk is on the
On the vertebra.
vertebra. Yeah.
Yeah. It's pre-vertebral.
Hypogastric nerve.
Wait, you have the obturator nerve. Obturator nerve is on the medial side, okay? So psoas major, I said lateral is femoral, on top is genitofemoral, and on the medial side, that's a little deeper, you find the obturator nerve, which is this one, right? It goes straight to the obturator canal. Obturator nerve. Okay, and then hypogastric nerve. This one right here. Hypogastric nerve. Iliohypogastric nerve, I think. Yeah. Oh wait. No, hypogastric nerve. Okay, sorry. This is iliohypogastric nerve. It's a different thing, right? Don't get confused. Hypogastric nerve is where the abdominal aorta is, and right underneath it you have these plexus. What is this? It's these nerve plexus that goes downwards. Okay, these are hypogastric nerve. Yeah.
Let's start with
The regions.
Hypogastric.
Okay.
Iliohypogastric nerve.
콘드라이트.
Left hypochondriac.
Hypochondriac.
Yeah, 콘드라이트.
Left hypochondriac region. I mean, just the region is divided by the two mid-inguinal line. Yeah, just remember the mid-inguinal line and the mid-clavicular line are different, right? The mid-inguinal line is a little more medial. The clavicular line is further. If it makes sense, yeah. So you divide by the mid-inguinal line on the two sides, and then you have the what are the lines? The subcostal line, and then subcostal line, and then intertubercular line.
Tubercular lines and subcostal lines.
Yeah. Subcostal line is right here.
Subcostal line.
Yeah, subcostal line.
Intertubercular line.
Intertubercular line.
Mid-inguinal line.
Yeah, I think so. I'll double check it. Okay. Anyways, that's how you split it into 9 regions, right? And then you have the hypochondriac, this is on the where the spleen and the liver is. You have the epigastric region there. You have the umbilical. You have the lumbar region. You have hypogastric, right?
This is called what?
Epigastric, sorry.
We're not recording it, but you can go do it.
What was this?
Right?
Hypochondria. Yeah, so left and right hypochondria. You have the epigastric where the stomach is. And then you have the umbilical in the middle. You have the lumbar region or renal region where the kidneys are. And you have these two regions, or inguinal regions, okay, inguinal, or it's called iliac regions. Yeah. Okay, and then you have the middle as the pubic region or the hypogastric region. Okay. And as I said, mid-inguinal plane is where the middle is the inguinal ligament. Subclavicular is middle of the clavicle. Subcostal plane is. Let's go to the skeleton.
So,
So mid-clavicular line, okay. So mid-clavicle. Mid-inguinal line is right here in the middle of the inguinal ligament, goes upwards, okay. And then you have the subcostal line is at the underneath the last rib.
Bulb of penis, flora of penis.
Yeah. Subcostal line. Okay. And then you have the
Basically, the part that goes into the
transpyloric plane is across from the pylorus. At the level of pylorus is at L1. L1, okay. So basically you have L5, 5, 4, 3, 2, 1. So at the level of L1 is where the transpyloric plane is. Okay, pylorus. Okay. Transpyloric plane. And then you have the transumbilical plane, which is basically next, go through the umbilicus, right? Through the umbilicus. That's at the level of L2, I think. You have the intertubercular plane, because you have the two iliac tubercle, right? Remember, iliac tuberosity is at the back. Iliac tubercle are these external part of the iliac crest. So the line between them is the intertubercular plane. Okay? And then you have the supracrystal plane. It's the highest part of the iliac crest, right? Iliac crest, and then the highest part right here. You have a line between them, that's the supracrystal plane, right? Supracrystal plane at the level of L4. Okay.
Supracrystal is above the intertubercular line.
Yes, it's above. Yeah, it's higher because it's the highest point of the iliac crest. And then you have the interspinous is between the two asses.
Interspinous?
Yeah, anterior superior iliac spine. Yeah, interspinous.
McBurney's point.
McBurney's point is the line between the asses and the umbilicus, right? You have the umbilicus at the middle, okay, and then you have the line between them, and then you split that line into 3 parts. So 1 part, 2 parts, and you just take the lateral 1/3 of that line. That's where the appendix is gonna be. Yeah. So that's McBurney's point is where they used to like cut, for appendix resection.
And let's go to the retroperitoneum.
Just to show you, basically you have the umbilicus.
Umbilicus?
That's my umbilicus. Right here.
This one.
Yeah. Umbilicus, and you have the asses. So you have the line between them, and then you take the lateral 1/3 of the line. So like you have 1/3, 1/3, 1/3. You have the lateral 1/3. Right there is where you're supposed to be the appendix. So that's the McBurney's point.
There's McBurney's point too. Retroperitoneum.
Retroperitoneum. There's the kidney. Everything behind here. That's the retroperitoneum.
Here. Okay. Oh yeah, that's it.
That's it?
Yeah.
Thank you so much.
Thank you so much.